way to correct the system when, for example, as in American healthcare, the system itself is so fractured that it has so many pieces that the idea of there being a one-size-fits-all in American healthcare has become a huge, political decision that divides the country. So how do you, what prescription can you give, pardon the pun, for a system that is as unsystematic as American healthcare is?
So we wouldn't call American healthcare a system. We would say that a system is something where there is a single, we would say that a hospital is a system, because that's the level at which you can actually measure the noise and you can put in place remedies to the noise within a hospital. Maybe it's within a hospital system or something like that, but it's not the entire healthcare system. That's more than what we call a system, just for clarity. Within what we call a system, which is essentially an organization, there's a number of things you can do to reduce noise. First, you can measure it. And when people realize how much of it there is, they usually have a shock. They usually say, oh my gosh, this is not what we expected. This is not what we owe our constituents, our voters in public service, or our customers in a for-profit company. So they realize that they need to arrive at more consistency. How can they reach more consistency? There's a number of ways. One way is, which is costly, but maybe the only way in some organizations, is simply to use several judgments. If you average the judgments of multiple people, which is, for instance, in the judicial system, sometimes what you have when you have a jury or when you have a panel of judges, when you average the judgments of several people, you will have less noise. Having said that, the way it's done in most organizations, including juries, does not work, because it actually creates more noise through the process of deliberation, where social influence between people can actually amplify the initial variability. So if you want to leverage the true collective wisdom of a group of people, of a group of qualified people, you need to make sure that before you aggregate their judgments, you're going to elicit those judgments independently. You're going to get them separately, and you're going to make sure that each of these skilled individuals has a chance to opine on the problem separately before you actually discuss it and eventually come to a decision. That's one of several ways you can have more decision hygiene. There are many other ways, and we draw lessons from different fields in which noise has been reduced. There's the example of forensic science, which is truly interesting. There's the example of recruiting decisions, where there are decades, in fact, a century of research on how to reduce error and noise. There's the example of performance management, which is very interesting because noise is massive there. In all these domains, some organizations have made progress in reducing noise, and we can learn from their experience.
Hachette,